Welcome to The Blend, a podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. In the third installment of this four-part episode, Dr. Sonal Choudhary, a dermatopathologist, dermatologist, and director of the Integrative Dermatology and Skincare Clinic at the University of Pittsburgh Medical Center, and Jazmyn Phillips, a Dermatology Physician Assistant at the University of Pittsburgh Medical Center, discuss some of the comorbidities that travel with hidradenitis suppurativa, such as inflammatory bowel disease, insulin resistance, and metabolic syndrome, and the potential role for yeast-free or Mediterranean-style diets as adjunctive therapies. They also weigh in on the use of injectable weight loss medications in this patient population.
I did just want to start with talking about inflammatory bowel disease and how a 2020 meta-analysis did find a significant association between HS and inflammatory bowel disease. And it actually might not be bidirectional, which is very interesting. A study did show that inflammatory bowel disease does have a causal effect on HS, whereas HS does not affect IBD. So that kind of shows why gut dysfunction is really important and should be studied more. And there's always studies happening, and I can't wait to see more of the research come out on that.
Yeah, I'll take you from there, Jazmyn, because some of the integrative medicine conversations is around gut microbiome, right? And there's a lot of research coming out talking about how microbial dysbiosis in the gut impacts the skin. And HS is no stranger to this conversation. In fact, I think we didn't say this enough for other disease states, but HS is definitely considered a metabolic disease. It has associations, like you said, with inflammatory bowel disease, but also with metabolic syndrome. When there is what we say gut dysbiosis or leaky gut, sometimes that's the word we use, it leads to inflammatory markers being increased at the level of the gut, and that translates into systemic inflammation, immune dysregulation, inflammation on the skin. Now, there are certain profiles of gut microbiome dysbiosis that have come to light specifically for HS, like a higher abundance of pro-inflammatory bacteria like proteobacteria or actinobacteria, and lower abundance of some of the anti-inflammatory bacteria like Firmicutes and Bacteroides in HS patients. Now, there's something called short-chain fatty acids, SCFAs, and SCFAs are they are these fatty acids, these molecules that are generated in our gut as fuel that the bacteria eat. So when the bacteria interact with the gut wall, or when a dietary thing like a food, any kind of food is getting digested in our gut, we end up producing SCFAs. And these SCFAs are crucial in a lot of the processes, cellular processes in our body. So they're important, they need to be there. Now, what are the common SCFAs? We should know acetate, butyrate, and propionate. I think this is our kind of first time introducing the concept of SCFAs, but when you're talking about gut barrier function and any kind of associated down-regulated pathway from there onwards, SCFAs are very, very important. So in general, there is a decreased production of SCFAs that has been seen in patients with HS. And that's not a good thing because it's indicating disrupted intestinal barrier equal to increased permeability, increased systemic inflammation in these patients.
Yeah, so, with that being said, that's what makes the gut such a direct target to look at when trying to treat patients with HS. And how do we best know how to target the gut? Well, by diet and what you eat. So, there's actually something that we emphasize a lot with our HS patients called the anti-inflammatory diet and lifestyle. Now, that can be very complicated, and we usually will send patients to a dietitian to kind of help them put these pieces together. But one dietary place that there actually has been studies that show that it can help is actually a yeast-free diet. So something called brewer's yeast. It's been shown that a diet excluding this can actually stabilize HS symptoms and cause rapid symptom improvement in many patients. So, when someone thinks of a yeast-free diet, what type of foods are you thinking of? Well, you're thinking of certain baked goods, beers, kombucha, soy sauce, miso, even some types of berries and grapes can contain yeast. So that's really where the dietitian comes into play, because they're able to really help patients figure out like what would be best for eating and not eating. And, in particular as well, I just want to mention that we do recommend a yeast-free diet as an adjunct therapy, especially with those who have recurrent flares and just had procedure or surgery, because we have found that patients who have surgery and are on a yeast-free diet actually have better outcomes as well. So this really can be a critical thing. Dr. Choudhary, do you have any other dietary type things to look at?
Yeah, I mean, this information that you just gave actually was from this big study done in 2020, and those patients had pretty high levels of antibodies against brewer's yeast, which, by the way, is also known as Saccharomyces cerevisiae. So these patients had high levels of antibodies to this yeast, and then they were treated with, like you mentioned, a yeast exclusion diet. They did really well on their surgery outcomes, and I believe, if I'm not quoting this incorrectly, that some of the patients who actually went back on eating things that had yeast in them, their HS flared. So very interesting finding. It's very applicable, something to talk to patients about. But I will say it can be overwhelming information for patients. So I try to give them a handout, at least in clinic, of yeast-free diet. What does that look like to kind of get them started? And if it is still overwhelming and difficult for them to do, because it will be, it is hard. If you ask me to do that, I'm going to hesitate for a while. So we try to then connect them to the nutritionist, and we do have a team of people who understand these different types of nuances with dietary changes, and it can be much more successful for the patients. Yes, I do have a couple other things to add to that dietary list. High glycemic index foods and saturated fats have been shown as triggers for HS flares. Now, I'm quoting it from a study, to be honest. Even dairy consumption, limiting dairy consumption does show improvement in HS. Straight away, you're looking at the insulin pathway, as we were talking about. You mentioned metformin and insulin pathway's role in any metabolic disease, not just HS. So kind of focusing on not doing high glycemic diets where you're not causing spikes in your insulin slash glucose is very important. Does that sort of bleed into talking about exercise? Absolutely. So if somebody eats a meal, especially a big meal, and you are right away laying down, you are really storing a lot of that glucose in the form of fat. However, if you do a walk afterwards, you are moving, exercising, it doesn't have to be intense exercise, but if you're moving, you're mobilizing that glucose. Little small dietary changes, lifestyle changes are very important. And they actually found it in this one other study where intense exercise, people who were able to do intense exercising, they had better adherence to Mediterranean diet in HS and had better outcomes with their HS lesions. So we should talk about Mediterranean diet, by the way, Jazmyn, and I know you know a lot about it. So tell us a little about what they know of Mediterranean diet. What does that even mean? Because it's so popular, utilized in many different disease states. So what is it?
Yeah, of course. So the Mediterranean diet is basically this generic term that's based on traditional eating habits of people in the countries that border the Mediterranean Sea. Why do we care what they eat? Well, a lot of studies, and there's documentaries on this, have shown that people from those countries tend to live a very long time, well into the hundreds, and they were kind of doing it when it wasn't as common. So the basis of the diet is eating plenty of fruits, vegetables, bread and other grains, potatoes, beans, nuts, and seeds. It also likes to use olive oil as the primary fat source, and it kind of tries to avoid a lot of meats, particularly red meats, beef, pork. If, meat is necessary sometimes for protein, looking more at fish and chicken in limited amounts, and then also trying to avoid a lot of dairy products and eggs. So that's kind of what the Mediterranean diet is.
I would say, practically speaking, I think Mediterranean diet is also much more doable. And it does have quite a bit of a crossover with what we also know popularly as the anti-inflammatory diet. So there is this, it kind of makes it a little easier for people to do. I will say that at our integrative clinic, we do like to take our time and walk people through a whole plan and a whole schedule of what an anti-inflammatory dietary process looks like. We have our own version version of it created, a very practical sort of manual that we created over time. We give out to our patients, but we don't just hand it to them, because there is no understanding and motivation when you just hand something easily like that. We will sit down and we'll walk them through this manual that is full of pictures of products, food products. I find that much more something that sticks with people, that they're able to do it. So yes, Mediterranean diet is definitely for the win here. We know that about that obesity phenotype in HS, and of course, reduction in weight, whether it is by dietary changes, whether it's by exercise, and whether the dietary change is happening because somebody tried Mediterranean diet, whether they tried, I don't know, ketogenic diet. It doesn't matter. The fact that they are able to lose weight one way or another itself can improve HS outcomes and HS lesions. In fact, when these lesions are improved, their need for antibiotics or surgery obviously will go down.
Yes, definitely. And that's always nice too, because as we talked about way in the beginning, antibiotics can carry this GI risk and some side effects. So it's always great when we can avoid them if possible. And, we continue to mention this and touch on this because it's so important, but the role of metabolic disease and insulin resistance in HS. And I always like to mention this 2018 case control study that actually used something called HOMA-IR, HOMA-IR, which is a value that measures the amount of insulin based on fasting plasma insulin levels and glucose levels. So whenever you're in a fasting state, your insulin should be controlled. However, in patients with HS, their levels can still sometimes be high, making them what we call having insulin resistance. And particularly in this study, they did find that the prevalence of insulin resistance was significantly higher in HS patients compared to the controls, higher being about 43% as compared to 16%. So that's a pretty high number and difference. And so, from the integrative perspective, we take this to heart and we kind of think, what can we do? So Dr. Choudhary, I'll ask you, what would you maybe do for a patient that has evidence of insulin resistance?
I think we can talk about that for a whole other day. I will keep it brief, and I will say that while there is no direct data on HS, a lot of things that translate from like metabolic disease elsewhere does very well translate for HS as well, because it is you have to think it in a well-rounded fashion. Now, somebody is trying to lose weight, they are trying to reduce inflammatory disease state, etc. So, of course, the top one that comes to mind is berberine. This is one of our favorite things because it has such an important impact on insulin resistance itself. We have talked about this previously in some areas, and I will, reiterate to it that berberine is actually a spice or a natural alkaloid that's found in certain plant species, and it has been utilized a lot in traditional medicine because it has antimicrobial, anti-inflammatory, and antioxidant properties. Now it is actually very readily available all across the United States. Of course, I always will make people beware of the purity problems with any supplements out there. But if you get your hands on a good quality berberine, it has very good properties that can help with insulin resistance. And while, metformin is not necessarily an herb or a supplement, it also can be utilized for managing metabolic disease. I, as a dermatologist, do not go about prescribing metformin to people. I have seen things happen with, we see when you practice for a while, like you see things, then it makes you a little wary. So I like to have a team member on something like that. So often the patient's PCP could be that person who can say, yeah, I mean, metformin could be something they qualify for or they feel comfortable in starting the patient on. Bizarre things such as like, hey, can metformin worsen somebody's gastroparesis? I try not to venture into spaces that can be questionable if it is not a direct drug use for their HS, but just know that, we know that it is a medication that helps with insulin resistance. So it can definitely have implications here.
Yes, definitely. And another big, big, big class of medications that really work on insulin resistance and metabolic disease are the GLP-1s. So we definitely have to mention those. GLP-1 receptor agonists are a group of medications that basically enhance what GLP-1 does, which is enhance insulin secretion, inhibit glucagon release, and slow gastric emptying, which basically all can help lower blood glucose levels. And in addition, they can promote weight loss and have been found to have anti-inflammatory effects, particularly on tumor necrosis factor alpha and interleukin 17, which we mentioned as key players in the HS pathway. There was a systematic study in 2024 that some of the GLP-1 receptor agonists, specifically liraglutide and semaglutide, did lead to significant reductions in weight and systemic inflammation in HS patients, which notably, what I find most important too, is they did also say that they had improvement in lesion severity and quality of life. That for us as dermatologists, and they say being on a medication helped improve my quality of life. There is nothing that makes your day better. So this class of medications is definitely still being researched specifically for HS, but that research is rapidly expanding, and a lot of them are being studied directly for HS now.
What do you think about the use of GLP-1s in HS, Jazmyn?
I mean, I think anecdotally in the clinic, from what I've seen, they can sometimes be a great option. I have had patients who are on them and they come in and they're like, I'm on this GLP-1 agonist for this other reason, but I'm also finding that it's improving my HS. And I just say, yay, I'm so happy to hear that. It makes me excited. And it definitely makes me excited to see more research come out about this class of medications for HS specifically.
I agree. That's kind of my experience with it too. But I do see some of the patients who have had no improvement in that. So I think the data coming out on it more clearly, which GLP-1s are working, and if there is a specific one that has more activity in HS or impact rather, would be really good to have as an option because, it's targeting that weight loss component. One thing that I worry about, and I'm really, hopeful that anybody who is prescribing GLP-1s is talking to their patients about is, loss of muscle. So a lot of patients end up losing muscle if they're not also doing like resistance training or muscle building exercises or eating enough protein in their diet. Then the GLP-1s can have long-term detrimental effect on their health. So the short-term effects being great, we also have to keep the sort of the eye on the prize on long-term health. And that's where I get a little wary about long-term use of GLP-1s without additional interventions from the prescriber. So if they have not already discussed that with the patient, I kind of bring that information to the patient and tell them you should talk to the person, the provider who's prescribing the GLP-1s, because muscle is what allows us to maintain our health over long periods of time. It can help prevent insulin resistance and all the bad things that we have been discussing. So that should not be sort of the negotiation that we lose all that muscle and just to, gain short-term benefits.
We hope you enjoyed part 3 of our 4-part episode on integrative approaches to treating HS. Thank you for listening to The Blend. We'll see you back next time.